COVID can affect the heart both by damaging heart muscle cells as well as by the inflammatory cells that circulate in your blood that can go into the heart trying to attack or repair damage from infection. So yes, COVID-19 does cause direct damage in the heart. There are two groups of people who get COVID infection who have some meaningful amount of heart involvement. The first is those people who are in the hospital, those people who are sick and sometimes need respiratory support. They can get heart involvement for a number of reasons: heart damage, both from myocarditis, but even more from the low oxygen that happens with lung infection, or from the inflammation that affects the whole body, called a cytokine storm. Those are terribly important in the hospital patients. The second group are young people, such as athletes, who would be participating in sport. If they get infected, there's a very low risk of heart involvement, but if it does happen, I think it's more likely to be myocarditis rather than those other mechanisms in the older hospitalized patients. This is a new virus. We've never had to uh, study it before. It's different than other viruses that cause myocarditis. And we don't know for this specific virus what the actual risks are. So the first opportunity is following people prospectively to determine if there is a meaningfully high risk of arrhythmias or sudden death or heart failure. The second is treatment trials. And at Mayo Clinic, we have led the national effort for convalescent plasma, which is now showing positive results in people who are sick or in the hospital, as well as we are part of significant studies that block the immune system, studies aimed at specific molecules like interleukin-6, which are mediators of inflammation, as well as the antiviral trials. And finally, of course, we all want to know what will happen with the vaccine trials a few more months before those results are available. There have been several reports where people are clinically better, but there's still imaging evidence of some cardiac injury. And we do not know yet the clinical significance, meaning the risk of arrhythmias or future heart failure from these imaging findings. That is an area of intense research.